when they should be focusing on getting better. And we need to do something about it. And what's happening in Washington right now, there's it's not a perfect bill, right? There's a bill in the House, a bill in the Senate. They're not perfect. But the reason I'm working on this is we have this opportunity now with a president who believes in this and large majorities in both houses of Congress that believe in this to varying extents. And we have this opportunity to really do something, to really change things, which is why we worked so hard last year to elect President Obama, was because we wanted to change things. And we have this opportunity, and so even if it's not perfect, I think we can establish the principle that we have a public responsibility to ensure that everyone gets the health care they need when they need it. I think the bills before Congress do that, establish that idea of responsibility and provide health care to 30 million Americans who don't currently have it. And also create alternatives to private insurance companies. We're not sure what form that's going to take yet, but it's going to be something like what Medicare is now for people over 65. And I think that's also a really important thing that, private insurance, there's an alternative to private insurance companies, because I don't think it's right that, people should be profiting off of, people's health. I think that's wrong. So Nick's going to go into a little more of the details of the actual bills, and as I said, they're not perfect, but they do establish the idea, and they do work towards getting universal coverage. Close enough that I am working every day to make sure it happens this year, because we have this historic opportunity, and I think we can't let it slip away. So yeah, that's my story. So I'll bring Nick up now and tell you a little more.